know this one is the tubule, and this is lined internally by the mucous membrane. So this is about the pharynx. So the pharynx is mainly derived from the Greek word that means a throat. That's why it is named as a pharynx. Now, when you see in this diagram, you can see over here, this one is known as the base of the skull, and this one is these are the cervical vertebra. You can you can easily count those vertebra. This one is the C1, C2, C3, C4, C5, and C6. Now, why C1 is a small one? The C1 has just the anterior arches there and the posterior arches there, which is very small in comparison to the other cervical vertebra. Now we compare the second cervical vertebra with the third one. The third one is other cervical vertebra are also small in comparison to the C2, because the C2 has got the dens, you know the dens, the C2 has the elongated process that is known as a dens. That's why when you cut the C2, you can see an elongated part. So this one is a C2. Now come to the pharynx. The pharynx will extend from the base of the skull. This is the base of the skull to the C6 vertebra. So you mean C1, C2, C3, C4, C5, C6 up to here. The whole this part is known as the pharynx. This is the extent of the pharynx, and you have to know this one. Now, next one is the function. As you know, the pharynx is a common channel for both food and for both air. So it is a common channel for both food and air. So you'll be reading the pharynx in the respiratory. I think we have learned about the pharynx in the respiratory system also. Now, next is the measurement. It is about 12 to 14 centimeter, and when then the widest below the pharynx, this will continue at over here at the C6 vertebra. From below over here, it will continue as esophagus. So this one is the pharynx, this one is the esophagus, and this one is the narrowest part of the pharynx. That is only 1.5 centimeter. Now we'll move on to the boundaries. Now when we have to talk about the boundaries. Now superiorly, just see the superiorly, what is there. Do you see? Can you see this one? The cavity over here. This is known as the sphenoidal sinus. Now you know the sphenoidal sinus is present in the bone, and this bone is known as the body of the sphenoid. Now superiorly, we have the body of the sphenoid. Now can you see the mark over here? This one, the joint. Oh, so this part is the sphenoid, and this part is the occipital bone. Occipital bone you know the occipital. Now the sloping part of the occipital bone is known as the basilar part of the occipital bone. Now the superiorly, it will be bounded by the body of the sphenoid plus basilar part of the occipital bone. That is the superior boundary. Now to come to the inferior one, when you have to talk about the inferior, what is there in the inferior one? At the level of the C6 vertebra, the pharynx will continue downward as esophagus. So that is the inferior one. Now see the posteriorly. So what are there in the posterior? 6 cervical vertebra, C1, C2 up to C6 vertebra. Then in between those vertebra, we have the intervertebral discs. All those are the intervertebral discs. Now next one is anterior to those vertebra. Can you see small ligament? That's not the small one. Can you see the long ligament? This one. This is known as the anterior longitudinal ligament. Now this one is the pharynx. Now can you see just behind the pharynx? Can you see a small gap present over here? This gap is lying behind the pharynx. That's why this is known as a retropharyngeal space. That is known as the retropharyngeal space. So posteriorly, we have the 6 cervical vertebra. Then we have the intervertebral discs. Then we have the anterior longitudinal ligament, retropharyngeal space. Those are the posterior relation. Now, in a simple way, you can say it as posteriorly, we have the 6 cervical vertebra and the intervertebral discs in a simple way. Now, next one is anteriorly. So, anteriorly, what is there? This one is this hole is the pharynx. Anteriorly, this part, upper part of the pharynx will communicate with the nasal cavity. This part will communicate with the oral cavity, and the lower part will communicate with the larynx. Now, how this is going to communicate with the nasal cavity? Now, can you see this opening? The gap over here, this one is known as posterior cone. Concha. Those are known as a concha, supranasal concha, infranasal concha, and the superior, middle, and the inferior nasal concha. And this one is the posterior nasal aperture, also known as the posterior nasal concha, cone. So this is the communication. Now next is we have got this part. This part will communicate with the oral cavity through the oropharyngeal stomach. Somewhere over here we have got the oro. Somewhere over here. Okay. Palatoglossal, somewhere over here. Over here we have the palatoglossal arch, and this through the palatoglossal arch, this will communicate with the oral cavity. Now this one will communicate with the larynx through the inlet of the larynx. So this one over here we have the inlet of the larynx somewhere over here. This is how they are going to communicate with the nasal cavity, oral cavity, and the larynx. Now, on each side, what will be present on each side? On each side, we have the stylet process. In this diagram, can you see this? The sharp part. This is known as the stylet process. Now, this stylet process, you blue color could take so you blue color. This one is the part of the frontal bone, and this one is the part of the this pink color. This one is the temporal bone, and this stylet process is a part of the temporal bone. Now laterally, the pharynx will be related laterally with the stylet process, and we have the three muscles and the two ligaments that are attached to the stylet process. Those two ligament plus three muscles attached to the stylet process, those are known as the styloid apparatus. Now, styloid apparatus mainly consists of the three muscles and the two ligament attached to the styloid process. Now, you do not have to remember all those muscles and the ligament. त्यो याद गर्नु पर्दैन, म भनिदिन्छु मात्रै. So the muscles which are attached to the tip of the styloid process, those are known as the stylopharyngeus muscle, styloglossus, and the stylohyoid. Now the ligament are the stylohyoid and the stylomandibular. So altogether we have the five structure that will form the styloid apparatus. Now just lateral to that we have the carotid sheath. Those are the lateral relation. Now come to the division of the pharynx. Now the pharynx is further divided into three: nasopharynx, oropharynx, and the laryngopharynx. Behind the nasal cavity, behind the oral cavity, and behind the larynx. Now we'll move on to the individual part of the pharynx. Now first the nasopharynx. Nasopharynx is the upper part of the pharynx. Now anteriorly this will communicate with the nasal cavity through the posterior nasal aperture. So this is the posterior nasal aperture. And inferiorly it will communicate with the oropharynx. And roof and posterior wall area. So the roof and the posterior wall is the continuous one. Now the roof is formed by the body of the sphenoid, basilar part of the occipital bone, and this one will form the posterior wall, which will be continue with this part. This one is the atlas. So altogether the roof and the posterior wall will be continuous, formed by the body of the sphenoid, basilar part of the occipital bone, and the first cervical vertebra known as the atlas. Now over here, in between the roof and the posterior wall, can you see the aggregation of the lymphoid tissue? This is known as the pharyngeal tonsil, or also known as the nasopharyngeal tonsil. And you know what do you mean by tonsil? Tonsil are the aggregation of the lymphoid tissue that are known as the tonsil. Let's see the lateral wall. Now all of anterior boundary pani bhayo, superior boundary, roof, and the inferior communication is over. Now see the lateral wall. Now when you see the lateral wall, can you see the opening? This opening, this small opening, this opening is known as the pharyngeal opening of auditory tube. This one is the pharyngeal opening of auditory tube. Now just above the pharyngeal opening of auditory tube, can you see the another elevation? This is known as this one is known as a tubal tonsil. Right? This is known as a tubal elevation. They like tubal elevation, right? Tubal tonsil. Number 2. Now next is why this is known as a tube. This one, This one is known as tube because over here we have the opening of auditory tube. Now, what is the another name for the tube? Tubula orco-oedma ki bhaniन्छ? The tubula orco-oedma, we call it as a salpingo because fallopian tube pani you just recall another one. The fallopian tube is there. For the fallopian also we call it as a salpingo. So the tube is given as a salpingo. Now, can you see the fold? One fold is passing towards the pharynx and one fold is going towards the soft palate. Now that fold which is going towards the pharynx, this is known as the salpingopharyngeal fold. And just see, this is known as the salpingopharyngeal fold. And this fold which is going towards the palate from the tube, salpingo भयो palate-सँग गएको palate. So you just join those two words, salpingopalatine fold. Salpingopalatine fold and salpingopharyngeal fold. So we have the two one. Now next one, the fifth one is the pharyngeal recess. Now just behind the tubal elevation, we have the gap, some gap is there, some part, concave part is there. This is known as the recess is there, so this is known as the pharyngeal recess. So these are the features which are present in the lateral wall of nasopharynx, and you have to remember this one. This one is important. Now I'll move on to the individual features. Just see, the first one is the auditory opening of the auditory tube. Now, what is the location of the opening of the auditory tube? This one is the superior nasal concha, middle nasal concha, and the inferior nasal concha. And this one is the posterior end. Now, the opening of the auditory tube is 1.25 centimeter below and behind the posterior end of inferior nasal concha. That is the location of opening of the auditory tube. Why we need the opening of auditory tube? What is the importance of the opening of the auditory tube? The auditory tube ले के लिए communicate गर्छ? The auditory tube will communicate the nasal cavity, nasopharynx with the middle ear. You know that one, eh? Auditory tube will communicate the nasopharynx with the middle ear. That means this opening will help to the opening of the auditory tube will help to equalize the pressure against the tympanic membrane. Tympanic membrane outside we have the external ear, and the external ear will be filled with air. Now come to the middle ear. Now from which part the middle ear will receive the air? Now this is the part from where the air will move into the middle ear. Now on the either side of the tympanic membrane we have the air, so this will help to maintain the equilibrium on either side of the tympanic membrane. Is it clear, this one? Repeat गर्नुहोस् भने you just tell me, I'll repeat once again. Auditory tube को communication के हो? What are the two part which will be communicated by the auditory tube? One is the nasopharynx, next one is the middle ear. Our external ear, middle ear को बिचमा what is there? The tympanic membrane is there. External ear मा त बाहिरबाट atmosphere बाट the air आउँछ, हैन? Now in the middle ear, from where the air will come? The air will come from the nasal cavity, from the nose into the nasal cavity, into the nasopharynx, through this opening into the auditory tube, into the middle ear. That means on the either side of the tympanic membrane, we have the air. So that this will help to equalize the air pressure against the tympanic membrane. This is one. Now next one is the tubal elevation. Clear, भयो? Now next is the tubal elevation. So how those elevation are formed? The tubal elevation are mainly formed. अब यो tubal elevation को भित्रपट्टि हेर्ने हो भने we have the aggregation of tonsil, and this aggregation of the tonsil which is present over here is known as a tubal tonsil. Now just consider, we have the aggregation of the lymphoid tissue that is known as a tubal tonsil, and this is covered by the mucous membrane, and this will form the tubal elevation. So your tubal elevation कसरी form भएको? We have the aggregation of lymphoid tissue covered by the mucous membrane. This will form the tubal tonsil. And what's the main importance of the tubal tonsil? Tubal elevation importance के हो? The tubal elevation will provide the guide to the surgeon, because the surgeon has to pass the catheter. Now in order to pass the catheter through the auditory opening, through the pharyngeal opening of the auditory tube, this tubal elevation will act as a guide. अब किन क्याथेटर पास गर्नुपर्छ because sometimes there may be a retraction of tympanic membrane now and that may cause the pain. So in order to relieve the pain from the retraction of the tympanic membrane, the surgeon will pass the catheter through the through the pharyngeal opening of the auditory tube, and they will inflate the air, and this will relieve those symptoms. Okay? And for that purpose, in order to pass the catheter through this opening, the tubal elevation will act as a guide. Is it clear this one? You बुझिदिए मुरली?
Yes, sir.
Now, next one is the salpingopharyngeal fold. Now, the salpingopharyngeal fold is this one, going towards the pharynx. Now, how the salpingopharyngeal fold is formed? Inside this fold, we have got the muscle known as the salpingopharyngeal muscle. Now, the salpingopharyngeal muscle will be covered by the mucous membrane, and this will form the fold known as a salpingopharyngeal fold. Now, same thing. This one is known as a salpingopalatine fold. Our salpingopalatine fold, how this fold is formed? Inside this fold, we have the muscle known as a salpingopalatine muscle, and this muscle will be covered by the mucous membrane, which will form a slight elevation that is known as a salpingopalatine fold. So, in this way, all those structures are formed, and all those features are present in the lateral wall of nasopharynx. This is all about the lateral wall of nasopharynx. Now, if you are clear, then I'll move to another slide. के छ सोध्नुपर्ने कन्फ्युजन Shall I move to another slide?
Yes, ma'am.
Now, next is the nasopharyngeal tonsil, this one. So, the nasopharyngeal tonsil, this one tonsil is named as adenoid. That means it is derived from the Greek word adenoid, means a gland like. This is the aggregation of the lymphoid tissue which looks like a gland. So, the name is given as adenoid. Now, how this nasopharyngeal tonsil has been formed? This is formed by the aggregation of the lymphoid tissue beneath the mucous membrane. We have the aggregation of the lymphoid tissue, and this nasopharyngeal tonsil is more prominent in the case of children, and it get atrophies in the case of adults. So it has got some clinical condition that will develop in the children. Now, when this will get enlarged due to the irritation or due to the infection, then that condition is known as adenoiditis. Okay. Now, whenever you have the adenoiditis, then that will obstruct the nasal respiration because this will get enlarged. As a result, nasal respiration will be obstructed. So you can see over here also. Now, next is the oropharynx. Now, what is the extent of the oropharynx from here up to here? We have the oropharynx. This will extend from the soft palate to the upper border of the epiglottis. We have the oropharynx. Now, the oropharynx has got the bound superior communication with the nasopharynx, inferior communication with the laryngopharynx, anterior communication with the oral cavity through the oropharyngeal isthmus. So we have the oropharyngeal isthmus over here. Okay. And this oropharyngeal stomach will be formed by the palatoglossal arch on either side. Now, inferiorly is the same on laryngopharynx. Now, posteriorly, it will be related with the C2 and the C3 cervical vertebra. Let's see the lateral wall. The main important over here is the lateral wall. So on the lateral wall, can you see the elevation? This one is known as the palatine tonsil. So this is the palatine tonsil, which is present in the tonsillar fossa, which is present in the lateral wall of oropharynx. Now we'll move on to the tonsillar fossa, how those tonsillar fossa are formed. Now just see, this one is the enlarged part of the tonsillar fossa. Now anteriorly, can you see this is the triangular fossa, which is present on the lateral wall of the oropharynx, and over there we have the palatine tonsil. Now, anterior boundary of the tonsillar fossa. Now, can you see the arch? Oh, this arch is joining the or extending from the from the soft palate to the tongue. So this one is known as a palatoglossal arch. Now posteriorly, see the posterior? This is going towards the pharynx, extending from the palate. So this one is known as the palatopharyngeal arch. Now, how those palatoglossal arches are formed? This one is same that of the salpingopharyngeal. So this one is mainly formed beneath this arch we have the palatoglossal muscle. Beneath this arch we have the palatopharyngeal muscle. Now the apex is formed by the soft palate, whereas the base is formed by the posterior one third of the tongue. Now I'll repeat once again the tonsillar fossa. Anteriorly we have got the boundary relation. This is the palatoglossal arch. This one is the palatopharyngeal arch, which will form the posterior boundary. The apex by the soft palate, the base by the posterior one third of the tongue. Now see this diagram. This one is the tonsil. Now can you see this muscle? Over here, this muscle is known as a superior constrictor. Now, the lateral wall or the floor of the tonsillar fossa are mainly formed by the two muscle, superior constrictor muscle, and next one is known as a styloglossus muscle. Now, styloglossus muscle we cannot see over here, and if they keep saying styloglossus muscle, only superior constrictor muscle has been shown over here. Now, the tonsillar fossa, the content is the palatine tonsil. This is all about the tonsillar fossa. Now the gross part of the palatine tonsil. How it look like? The palatine tonsil, how do you define the palatine tonsil? This one is the ovoid mass of the lymphoid tissue which is present on the lateral wall of the oropharynx. Now what is the location of the palatine tonsil? Tonsillar fossa is the location. Now the measurement in adult, it is average 20 to 25 mm vertical and 10 to 15 mm transverse diameter. You just see those are present on the lateral wall of the oropharynx. Now, what is the part of the tonsillar, palatine tonsil? We have got the upper pole, lower pole, and this one is known as anterior border. This is known as the posterior border. This one is the medial surface, and behind that one we have the lateral surface. Now you can compare the palatine tonsil with the almond. Right? So just see this one also. This one is the medial surface, and this one is the lateral surface. We have the upper pole, lower pole, and the anterior border and the posterior border has not been shown over here because this one is the cut section. Now, main thing what you have to remember over here is you have to see the medial surface and the lateral surface. Now, what is happening on the medial surface? We can see the crypt. Right? Those numerous are known as a tonsillar crypt. It's a pretonsillar crypt. Now, among those crypt, one is more prominent. Oh, you have the two and one is the bigger one. This one is known as the intratonsillar cleft or intratonsillar. So you can see over here also this one. This one is known as the intratonsillar cleft. Now see the lateral one. Now when you see the lateral one will be covered by, can you see the green color? Green color line. This one is known as the capsule. Okay. अब ये capsule को बाहर पट्टी, can you see the white one? This one is known as the fibrous tissue. Okay. This one is the fibrous tissue. Now this fibrous tissue consists of the vein. This vein is known as a paratonsillar vein. Up here fibrous tissue को बाहिरपट्टि, can you see the green color line? This one is known as a pharyngobasilar fascia. अब इसको बाहिरपट्टि के छ, what is there? We have the supraconstrictor muscle. त्यसको बाहिरपट्टि we have the buccopharyngeal fascia. These are the structure present on the lateral surface. You सबै याद गर्नु पर्दैन. No need to remember all those. Just see the lateral surface is covered by the fibrous capsule. This is the fibrous capsule. We have got the fibrous tissue consisting of the paratonsillar vein. Then we have the pharyngobasilar fascia, superior constrictor muscle, then buccopharyngeal fascia. This one is the same. The medial surface. The medial surface will project into the cavity of the oropharynx. This will be covered by the mucous membrane, and we have the numerous tonsillar crypt. And among those, one is the deeper one. This is known as the intratonsillar cleft. The next is the laryngopharynx. Now, what is the extent of the laryngopharynx? What you have to explain is you have to explain this part, only this part, the blue one. Now, this will extend from the upper border of the epiglottis to the lower border of the cricoid cartilage. Our respiratory system has been already over, and in the respiratory system, this cricoid cartilage, these are the cartilage of the larynx. Your larynx cartilage, this one is the lower border of the cricoid cartilage. Up to here, the whole is the laryngopharynx. Now, main thing what you have to know over here is the lateral wall. Now, in the lateral wall of the laryngopharynx, we have the pyriform fossa. Why it is known as the pyriform fossa? Because it is just like a pear shape. Now, just see this diagram. Never get confused with this diagram. This diagram is the posterior view of the pharynx. When you cut the pharynx and reflect it laterally and view it from the posterior part, you can see like this. This whole is the pharynx. This one is the nasal cavity, this one is the oral cavity, and this one, inside this one, we have the larynx. Right? So just behind the larynx, we have the laryngopharynx. Now, on the lateral wall of the laryngopharynx, can you see a pierced fossa on either side? One and one over here. Those are known as the pyriform fossa. Those are pierced fossa. And this pyriform fossa is very important. This is important for your exam point of view also, and this one is important for your practical exam also. In your practical exam, anatomy practical exam, they will flag over here and you have to identify the pyriform fossa. Now the boundary, the main thing what you have to know about the pyriform fossa is you have to know about the boundary, you have to know about the relation of the floor and applied. Our pyriform fossa, this will be the medial boundary, this will be the lateral boundary. Now, what the medial boundary will be formed by? Our larynx the bhaisakyo haina. What is this? This is known as epiglottis. This is known as the epiglottis. This one is known as the this one. This one is known as the arytenoid. You arytenoid only, no? Arytenoid cartilage. Now the fold which is extending from the arytenoid cartilage up to the epiglottis, this is known as the aryepiglottical fold. Aryepiglottic fold. So medially we have the aryepiglottic fold. Now what about the lateral? So when you feel this part lateral, we have got the lamina of thyroid cartilage. Thyroid cartilage ko tha cha ni haina. Thyroid cartilage has got the two lamina, two lateral lamina. So we have the lamina of thyroid cartilage. Now another one just above the thyroid cartilage over here we have the hyoid bone, and this one will be over here we have the thyrohyoid membrane. Same, you just see this one. Can you see? Can you see the lamina of the thyroid cartilage and hyoid bone, and we have the membrane known as the thyrohyoid membrane. So the pyriform fossa will be present over here. So laterally we have got the lamina of the thyroid cartilage and the thyrohyoid membrane. That is the lateral boundary. Now next one is, see the apex. You apex see the apex. Now over here in tongue copasadipati, I think you have already learned about the tongue, and on either side we have, just behind the tongue we have the vallecula. So this vallecula will be separated from the pyriform fossa by the glossoepiglottic fold. You yad garnu pardane, that is not necessary for you. The main thing which you have to remember in the pyriform fossa is the floor. Now can you see some fold over here? Can you see some fold? This one? This is the fold. Now this one is the internal laryngeal nerve. Right? Inside this one we have the internal laryngeal nerve. So the floor is mainly related with the internal laryngeal nerve. Now applied anatomy is here. The pyriform fossa, why you need to study the pyriform fossa? The pyriform fossa is it mainly lost the foreign body like fish bone. That means when the fish bone gets stuck over here, and if you make a forceful attempt to remove that fish bone, then it may damage, you may damage the internal laryngeal nerve. बेलुकी यो pyriform fossa मा fish bone हरु अड्किन सक्छ. So when you make the forceful attempt to remove that fish bone, then sometimes you may damage the internal laryngeal nerve. Now when you damage the internal laryngeal nerve, now you recall the larynx part. Larynx ko class recall गरेर what is the So what are the area which will be supplied by the internal laryngeal nerve? The internal laryngeal nerve is the pure sensory one. It will only supply the mucous membrane present above the vocal fold. Okay, mucous membrane of the larynx above the vocal fold will be supplied by internal laryngeal nerve. Now, when the internal laryngeal nerve will get damaged, now what will happen? It will lead to the anesthesia of the upper part of the larynx. This is all about the piriform fossa. Now, see this one. अब internal laryngeal nerve त भनिराख्नु पर्यो यो त क्लास भइसकेछ है पहिला larynxमा. So this one is the vagus. This one is the supralaryngeal nerve. The supralaryngeal nerve is the branch of the vagus which will be further divided into one. This one is known as internal. This one is known as the external. The external is the motor supply the cricothyroid. Internal laryngeal nerve which pierces the thyroid membrane and supply the mucous membrane of the larynx above the vocal fold. Now same. This one is the vagus nerve which is giving another nerve which will be reoccurring. That's why this is known as a recurrent laryngeal nerve. So these are the branches of the vagus in the neck region. Main what you have to know is you have to know the internal laryngeal nerve. Is it clear the piriform fossa? बुझ्यो अब piriform fossa?
Yes, ma'am.
फेरि रिपिट गर्नुपर्छ piriform fossa?
No, ma'am.
To everyone?
Yes, ma'am.
Yes, ma'am.
Okay. Now next important topic is this one is known as the Waldeyer tonsillar ring. Now you have to know this one also. This one is also very important. Waldeyer tonsillar ring means this is the ring. This is the lymphoid tissue ring which is present around the upper pharynx, which will surround the upper pharynx. This is the lymphoid tissue ring that will surround the upper pharynx that is known as the Waldeyer tonsillar ring. Now what you have to do is you have to all those tonsil. अब हामीले के tonsil पढ्यौं त? What are the tonsil which we have read in the nasopharynx? Nasopharynxमा how many tonsils we have read about? We have read about the two one. One is known as the pharyngeal tonsil. That is also known as the nasopharyngeal tonsil. Next one is known as the tubal tonsil, which was there on just beneath the tubal elevation. Oh. Now next one, the lateral wall of the oropharynx, we have the another tonsil known as a palatine tonsil. Now next, in the tongue, in the posterior most part, we have the lingual tonsil. So how many tonsil will be there? Aware the superiorly. Superior is the one. This is the nasal. This will be 1 to 1. Now the tubal tonsil and palatine tonsil. These are present in the lateral wall. So we have the two on either side. And this is the lingual tonsil present in the tongue. This will also be 1. So this will form a ring of a lymphoid tissue present around the upper part of the pharynx, and this will act as a barrier to infection. This is known as tonsillar ring. Now, the ring mainly composed of posteriorly and superiorly we have the nasopharynx, laterally we have the tubal tonsil and palatine tonsil, and anteriorly and inferiorly we have the lingual tonsil. So this all tonsil will make a ring around the pharynx. This is known as the Waldeyer tonsillar ring. Is it clear this one?
Yes, ma'am.
फेरि भन्नुपर्छ? Shall I repeat Waldeyer tonsillar ring? Shall I repeat or?
Yes, ma'am.
Repeat or?
Yes, ma'am.
मैले एस भनेको कि नो भनेको बुझ्दै बुझिन.
Yes,
टाइप
ma'am.
गरे त. Okay, I'll repeat once again. Being the lymphoid tissue ring which are present around the upper pharynx. The main function of those are to act as a barrier to infection. Okay, this act as a first line defense to your the first line defense to your inhaled particles of food particles and nasal also, air also, inhaled air and inhaled food. Now, so what are the lymphoid tissue that will form our tonsillar ring around? So over here, posterior superiorly, we have the pharyngeal tonsil. So see, posterior superior, we have the pharyngeal tonsil. Then come and come to the lateral part. Laterally, in a lateral wall of the nasopharynx, we have the tubal tonsil. In the lateral wall of the oropharynx, we have the palatine tonsil. So those two will be present laterally. So we have those paired one on either side. Now, anterior inferiorly, किनभने टङ त अगाडि हुन्छ होइन anterior inferiorly we have the lingual that is a single one. So altogether 1, 2, 3, 4, 5, 6. All those 6 tonsil they form a ring around the upper pharynx that is known as the Waldeyer's tonsillar ring. Is it clear this one? अब बुझ्यो यो?
Yes, ma'am.
Yes, ma'am. Now the applied anatomy of those tonsil. Now I've already told you about this nasopharyngeal tonsil. When it get enlarged, that condition is known as adenoiditis. So adenoiditis, अब यो adenodectomy भन्ने पनि थाहा छ है. The removal of the adenoid is known as adenoiditis. Now, whenever we have the enlargement of the nasopharynx in the case of children, then what will happen? Then the children will develop a typical facial expression. This type of expression is known as adenoid face. Now, what will happen in the adenoid face? As the enlargement of the nasopharyngeal tonsil will block the nasal respiration or will obstruct the nasal respiration, the patient will inhale the air through mouth, and it makes the
Abi, roll camera.